Every 34 seconds, someone in the United States dies from cardiovascular disease. By the end of this video, nearly 50 Americans will have lost their lives. And here's the terrifying part. Many of these people had no idea they were at risk. They didn't feel any pain, they weren't showing any symptoms, but inside, they had underlying cardiovascular problems, silently taking over their health. Cardiovascular disease is the #1 killer in the United States, killing more people than all cancers combined. That's right, more than all cancers combined. That's a staggering, startling statistic. Terrifying, in fact, and it doesn't discriminate. It's the #1 killer of men and women alike. Coronary artery disease, also known as CAD, makes up roughly 40% of all these deaths. Many times, it starts without warning, with no obvious symptoms. And by the time someone feels that crushing chest pain or shortness of breath, it may be too late. The damage has already been done. In today's video, we're going to talk about what coronary artery disease is and why it's so dangerous, and how you can protect yourself from becoming part of that statistic. Because while cardiovascular disease claims so many lives, the good news is it's largely preventable, but only if you know the facts. At its core, coronary artery disease refers to the narrowing or blockage of the coronary arteries, the vessels responsible for supplying the blood to your heart muscle itself. The most common cause is CAD, atherosclerosis of the coronary arteries, a process in which plaques made up of cholesterol, fat, calcium, and other substances build up in the arteries. These plaques can restrict blood flow to the heart, leading to ischemia, which is a lack of oxygen-rich blood in the heart muscle. Eventually, this can cause a portion of the heart muscle to actually die. This is called a myocardial infarction, or MI. We all know this process by its common name, a heart attack, and nobody ever wants to have one because they can be deadly. So what exactly is the plaque made of? Well, it starts with cholesterol. Low-density lipoprotein, or LDL cholesterol, is often referred to as bad cholesterol because it can accumulate and form blockages called plaques in the walls of the arteries. Along with cholesterol, other substances like cellular waste, fibrin, and calcium can also contribute to plaque formation. The buildup of this plaque narrows the arteries, and as a result, the flow of oxygenated blood to the heart muscle decreases. As these plaques grow, they can narrow the arteries significantly. This progressively chokes off the heart from the oxygen and nutrients it needs to stay alive and to function properly. This can be a slow, silent, and steady process that ultimately leads to a heart attack. But other times, this can happen suddenly when a plaque ruptures. We've all heard terrible stories of people that we know or don't know suddenly dropping dead. These are terrifying tales, and we never want to see this happen to ourselves or a loved one. Other times, this can happen suddenly when a plaque ruptures. This can cause a total blockage of the artery, stopping all blood flow to a large area of heart muscle. Plaque rupture can then trigger the formation of a blood clot, which may completely block extensive areas of the artery and its branches, causing extensive damage to the heart muscle and having a major impact on the heart's ability to pump the blood to the rest of the body. This can be a life-threatening condition and is the primary reason that coronary artery disease is so dangerous. Now let's talk about one of the scariest aspects of plaque rupture. While severe blockages of 75% or more are typically the most concerning, it's important to understand that much smaller plaques can cause catastrophic events. This is especially true when the plaque is relatively young and the cap, the thin, fibrous covering over the plaque, isn't yet calcified or hardened. In these cases, the plaque can become fragile, and the high rate of blood flow at high pressure across it can spontaneously cause rupture. When this happens, the blood clot that forms can rapidly block the artery, leading to a sudden and massive heart attack. What's even more frightening is that someone experiencing this kind of plaque rupture may have had no symptoms or warning signs of heart disease beforehand. These people may have been completely asymptomatic, and suddenly the rupture can lead to a heart attack. This can result in a fatal arrhythmia or abnormal heart rhythm. One of the most dangerous arrhythmias is ventricular fibrillation, where the heart's lower chambers, the ventricles, quiver instead of contracting rhythmically and properly. This prevents the heart from pumping blood effectively and can cause sudden cardiac arrest if not treated immediately. This is what we call having someone drop dead, and it's a terribly frightening thing. This is why it's so crucial to keep our coronary arteries as clean as we possibly can. The more we can prevent buildup of plaque and keep our arteries clear, the lower our risk of experiencing these catastrophic events is. It's all about being proactive and keeping an eye on your heart health before something serious happens. Now let's talk anatomy for a second. The heart has a right coronary artery and a left coronary artery. These arteries branch out into smaller vessels that supply oxygenated blood to the heart muscle. When one of these arteries becomes blocked or narrowed, it limits the blood flow to the part of the heart it supplies. The result can be damage to the heart muscle, which affects the heart's ability to pump effectively. Reduced blood flow to the heart muscle can cause ischemia and weaken the heart's pumping ability, leading to a condition called heart failure or congestive heart failure, also known as CHF. This is a situation where the heart cannot pump enough blood to meet the body's needs. The most common problem is a reduced ejection fraction, which is the amount of blood the heart pumps with each beat from the left side of the heart to all of the other vital organs. But ischemia can also affect the right side of the heart, causing right ventricular dysfunction or failure as well. Both of these conditions can be deadly. Ischemia can also lead to valve dysfunction. If the heart muscle becomes too weak, the valves that control blood flow in the heart may not function properly, leading to issues like regurgitation, where blood flows backward through the valve. This further complicates the situation and may lead to additional symptoms like swelling in the legs, fluid retention, and pulmonary edema, fluid building up in the lungs. This is like drowning in your own body's fluid, a terrible, terrible feeling. And here's something that might surprise you. Cardiovascular disease kills roughly 940,000 Americans every year, with heart disease accounting for about 700,000 of these deaths. Coronary artery disease makes up about 370,000 of the heart disease deaths. This is a major public health concern, and it's affecting both men and women equally. In fact, cardiovascular disease is responsible for 1 in every 5 deaths in the United States. That's 20% of all deaths every year in the United States. The statistics are alarming, but with proper awareness and action, it's possible to make a significant difference. In future programs, we'll talk about other forms of cardiovascular disease, how they kill, and what can be done to prevent and manage them. For example, strokes. But today, let's focus on coronary artery disease. It's that important. Let's take a moment to talk about the risk factors for coronary artery disease. High cholesterol, high blood pressure, and diabetes are among the top risk factors for coronary artery disease. A family history of heart disease also increases your risk, and so does smoking, whether it's cigarettes, cigars, or pipes. We're also seeing growing concern over vaping and smoking marijuana and their association with cardiovascular disease. Even though research is still developing, it's clear that inhaling any chemicals into your lungs can have damaging effects on the delicate lining of the coronary blood vessels. In recent years, there's been an alarming rise in e-cigarette use, especially among younger generations. While e-cigarettes were initially marketed as a safer alternative to smoking, studies now suggest that they can be just as harmful, if not more so, when it comes to cardiovascular health. Research indicates that e-cigarette users have a significantly higher risk of developing coronary artery disease and experiencing myocardial infarctions to non-users. A study conducted by researchers from the University of California, San Francisco found that e-cigarette users were more likely to show signs of atherosclerosis, the buildup of fatty plaques in the arteries, compared to non-smokers. This is particularly concerning because atherosclerosis is the primary underlying cause of coronary artery disease. In fact, several studies have demonstrated that the use of e-cigarettes can lead to an increase in heart rate, blood pressure, and inflammatory blood markers. The other thing that's so worrisome about this is that e-cigarettes and vaping is extremely popular with young people. This is going to put their health at risk starting from a very young age. These findings are still being debated, but one thing is clear. Vaping is not a harmless activity. The long-term effects of e-cigarette use on cardiovascular health are still not fully understood, but early research indicates that it can accelerate the development of heart disease. And when you consider that millions of people worldwide are using e-cigarettes, the potential public health implications are enormous. Nicotine, the addictive substance in most e-cigarettes, is known as a vasoconstrictor. It's a chemical that narrows blood vessels, putting them into spasm, making it harder for blood to flow through the arteries. This contributes to high blood pressure, which is a major risk factor for heart disease. Additionally, the inhalation of vaporized chemicals, such as formaldehyde and acrolein, can cause direct damage to the blood vessels and the heart tissue. This further increases the risk of cardiovascular events like heart attacks and sudden death. So while e-cigarettes may seem like a safer option compared to smoking traditional cigarettes, the evidence suggests that they're far from safe. If you or someone you know is using e-cigarettes, it's important to understand that you may be putting your heart health at risk. A good lipid profile is essential. That means having healthy levels of HDL or good cholesterol, low LDL or bad cholesterol, and low triglycerides. Keeping your blood pressure under control is also key. An ideal blood pressure is below 120/80, or even 120/70, some sources say, and your body mass index should be in the normal range. It's also important to keep your blood sugar levels in check. Even prediabetes can increase your risk of developing coronary artery disease. Remember, there's no such thing as just a touch of sugar or a touch of diabetes. But prevention isn't just about diet and exercise. We're learning that stress can play a significant role in heart disease. But prevention isn't just about blood test results. We're learning that stress can play a significant role in heart disease. Finding ways to manage stress through things like meditation, mindfulness, and regular physical activity can help lower your risk of developing coronary artery disease. Stress has been shown to contribute to high blood pressure, unhealthy eating habits, and even inflammation in the body, all of which increase the likelihood of CAD, coronary artery disease. Exercise, particularly walking and aerobic activities, strengthens the heart and helps maintain a healthy blood flow. I always recommend at least 30 minutes of moderate exercise most days of the week. It's a great way to reduce the risk of coronary artery disease and improve overall heart health. When we talk about managing coronary artery disease, medications often play a key role. For many patients, lipid-lowering drugs like statins are prescribed to reduce the levels of bad cholesterol. Medications like atorvastatin, also known as Lipitor, or rosuvastatin, also known as Crestor, are among the most commonly prescribed statins. These drugs work by inhibiting the enzyme responsible for producing cholesterol in the liver, which can significantly lower LDL levels and reduce the risk of plaque buildup in the coronary arteries. Statins not only lower LDL cholesterol, but can also stabilize existing plaques in the arteries, making them less likely to rupture and cause a heart attack. In some cases, patients may be prescribed additional medications like ezetimibe or Zetia, which works by reducing cholesterol absorption from food, or PCSK9 inhibitors like alirocumab, Praluent, for patients who do not respond well to statins alone. In addition to cholesterol-lowering medications, blood sugar management is critical, especially for diabetic patients. Medications like insulin or oral agents like metformin, also known as glucophage, are used to help control blood glucose levels. Poorly controlled diabetes can accelerate the development of coronary artery disease, so controlling blood sugar levels is key to reducing the risk of complications like heart attack and sudden death. Sometimes, despite our best efforts with medications and lifestyle changes, coronary artery disease progresses and becomes more severe. When this happens, surgical interventions become necessary. Traditionally, coronary artery bypass grafting, or CABG, also known as CABG, requires opening the chest and generally using a heart-lung machine or cardiopulmonary bypass machine to take over the job of pumping and oxygenating blood during surgery. While many procedures still require the heart-lung machine, it's possible to perform coronary artery bypass grafting with the heart still beating. This technique, known as off-pump CABG or OPCAB, can be beneficial for patients who may be at higher risk for complications from being on cardiopulmonary bypass. As a matter of fact, when I was doing cardiac surgery, I did all of my bypass cases with the heart beating and not using the cardiopulmonary bypass machine. Most of us have heard of triple and quadruple bypasses, named for the number of blockages the operation is treating in that particular patient. These are performed commonly. Minimally invasive cardiac surgery is becoming more popular for coronary artery bypass grafting. Procedures like mini sternotomy, where a smaller incision is made in the breastbone, or even anterior thoracotomy, where the surgeon accesses the heart from the side of the breastbone, are becoming more and more common. Some studies suggest that these approaches may significantly reduce patient recovery times. Another approach is robotic-assisted CABG, or thoracoscopic CABG, where tiny incisions are made and a camera and/or robotic arms are used to help perform the surgery. These techniques potentially provide for smaller scars, less pain, and quicker recovery, but tend to be reserved for specific anatomical cases and clinical circumstances. When it comes to choosing bypass grafts, meaning the tubing or the conduits from the body that will be used to perform the bypass, bringing fresh blood from before the blockage to beyond the blockage, there are numerous options. One of the most common options is the great saphenous vein, which is a vein that runs from the ankle to the groin on the inside aspect or medial aspect of the leg and the thigh. The vein is removed from the leg and used as a conduit, or a piece of tubing, if you will, to bypass a blocked artery, allowing blood to flow freely to the heart muscle. We can talk more about this in future videos for those who are interested. Another option is the small saphenous vein, which is located in the calf area. This is much less commonly used, but can be used in patients who do not have a suitable great saphenous vein on the inside of the thigh and leg. This vein can also be used for bypass surgery, but is usually not the case. In addition to veins, some arteries can be used. The most common is the internal mammary artery, which runs underneath the breastbone on both the left and right side. These arteries have been found to be highly effective for bypass surgery, the left one being most commonly used. The internal mammary artery is well known to have great patency rates, meaning it stays open a long time and it's a durable bypass and provides excellent blood flow characteristics. In some cases, but rarely, both internal mammary arteries may be used for bypass, both the left and the right side. Additionally, for some patients, the radial artery from the forearm can be used, providing another alternative for bypass grafts. Another option for interventional but minimally invasive treatment of coronary artery disease is performed not by cardiovascular surgeons like myself, but instead by interventional cardiologists, another highly trained and very skillful group of physicians. One of the most common techniques they perform is balloon angioplasty. In this procedure, a small balloon is threaded through a catheter into the blocked artery, and once in position, the balloon is inflated, pushing the plaque aside and widening the opening of the artery, allowing blood to flow more freely. Today, in almost all cases, a stent is also placed during balloon angioplasty. This small mesh tube helps keep the artery open, preventing it from narrowing again. Stenting has revolutionized the way we treat coronary artery disease and is done in conjunction with balloon angioplasty to provide long-term results. In the United States today, many more balloon angioplasty and stent procedures are done as compared to coronary bypass procedures. For more complex blockages, a technique called rotoblader may be used. The rotoblader is a specialized device with a small diamond-coated tip that can sort of sand down hardened plaque, allowing for improved blood flow and preparing the artery for stenting. These minimally invasive procedures have revolutionized heart care and health care. In fact, in the United States, over 1 million of these procedures, balloon angioplasty, stenting, and rotoblader treatments, are performed every year. By using tiny incisions or even needle holes and catheters inserted through the groin or wrist, interventional cardiologists can clear blockages and restore blood flow to the heart, oftentimes with far less risk and recovery time than traditional open heart surgery. Thanks to these minimally invasive techniques, patients can experience quicker recovery times, less pain, and better outcomes, making coronary artery disease treatment more accessible than ever before. One of the most significant contributors to coronary artery disease and heart problems in general is an unhealthy diet. And I want to get into this. The foods we eat play a huge role in shaping the health of our arteries and heart. So what makes a diet unhealthy? Let's start with some common offenders. Unhealthy foods are typically rich in saturated fats, trans fats, simple sugars, and refined carbohydrates, all of which contribute to the development of plaque in the arteries. Saturated fats are primarily found in animal products like fatty cuts of meat, full-fat dairy products like cheese and butter, and processed foods such as pastries, cakes, and certain types of snack foods. These fats raise levels of LDL cholesterol or bad cholesterol, which promotes plaque formation in the arteries. But one of the real villains when it comes to heart health is trans fats. These fats are artificially created by a process called hydrogenation, which turns liquid vegetable oils into solid fats. You'll find these in many processed foods, including packaged snacks, baked goods, fried foods, and some margarine. Trans fats not only raise your LDL cholesterol, but also lower your HDL cholesterol, the good cholesterol, which plays a crucial role in protecting against heart disease. Then there are simple sugars and refined carbohydrates. You may think of sugar as a sweet treat, but consuming too much can have a profound effect on heart health. When you eat sugary foods like sodas, candies, and processed snacks, or refined carbohydrates like white bread, pasta, and pastries, your body quickly absorbs them into the bloodstream. This causes spikes in blood sugar, which can increase inflammation in the arteries and contribute to plaque buildup. Plus, frequent blood sugar spikes can lead to insulin resistance, a precursor to diabetes, another significant risk factor for coronary artery disease. On top of that, many processed foods are also high in sodium. Too much salt in the diet can lead to high blood pressure, which further damages the arteries over time, making them more prone to the development of plaques. It's a vicious cycle. Another key player in an unhealthy diet is processed meats. Think hot dogs, bacon, sausage, and deli meats. These foods are high in both saturated fats and sodium, and they're linked to higher rates of heart disease and cancer. The preservatives used in processed meats, like nitrate, may also contribute to inflammation in the body and damage the blood vessels. So now that we know what we should avoid, what does a heart-healthy diet actually look like? A healthy diet emphasizes whole, nutrient-dense foods and provides balanced nutrition. It focuses on foods that are naturally high in fiber, healthy fats, and lean proteins, and low in cholesterol, sugar, and processed ingredients. First, let's talk about the role of fiber. Foods that are rich in fiber, such as whole grains, legumes, fruits, and vegetables, help lower cholesterol and improve heart health by maintaining healthy blood sugar levels. Fiber also plays a crucial role in reducing inflammation, which is a key driver of coronary artery disease. Aim for a diet high in fruits and vegetables, and choose whole grains like brown rice, quinoa, oats, and whole wheat bread over refined grains like white rice and white bread. Next, we need to talk about healthy fats. Contrary to popular belief, not all fats are bad. In fact, unsaturated fats are essential for good heart health. These fats, which are found in foods like avocados, nuts, seeds, and olives, help to raise HDL cholesterol and protect the heart. Healthy fats also provide a stable source of energy and are crucial for cell function. One of the best sources of healthy fats is omega-3 fatty acids, which are found in fatty fish like salmon, mackerel, sardines, and anchovies. Omega-3s help reduce inflammation, lower triglycerides, and prevent clotting. If you don't eat fish regularly, omega-3 supplements made from fish oil or plant-based sources like flax seeds and chia seeds are excellent alternatives. Another great source of healthy fat is olive oil, especially extra virgin olive oil, which is rich in monounsaturated fats. This oil has been linked to numerous heart-healthy benefits, including reducing inflammation and lowering the risk of heart disease. Other healthy oils include avocado oil and canola oil, which also contain monounsaturated fats that can support healthy cholesterol levels. When it comes to protein, it's best to choose lean animal proteins such as chicken, turkey, and fish rather than fatty cuts of meat. Plant-based sources of protein like beans, lentils, and tofu are excellent choices as they are lower in fat and higher in fiber, which is great for your cardiovascular health. Nuts and seeds also provide protein along with heart-healthy fats. A heart-healthy diet is also rich in antioxidants and phytochemicals, which are found in brightly colored fruits and vegetables. These compounds help reduce oxidative stress, protect the cells in your arteries, and prevent plaque formation. Foods like berries, spinach, kale, carrots, and sweet potatoes are full of these beneficial compounds. The more color you have on your plate, the better. One of the great sources of flavonoids, which are highly antioxidant, is orange peel, believe it or not. Now, orange peels are hard to eat, but they can be found in numerous supplements. Diosmin and especially MPFF, micronized purified flavonoid fraction, are two places where an incredible mixture of bioflavonoids can be found for that antioxidant effect. In general, a healthy diet should be plant-based, meaning that most of your meals come from plant sources like vegetables, fruits, grains, legumes, and nuts. This kind of diet provides an abundance of essential vitamins, minerals, and fiber that are crucial for heart and overall health. And let's not forget, whole foods are always better than processed foods. When you're shopping, if something has a long list of ingredients on the back of the box, you're probably heading in the wrong direction. Whole, unprocessed foods like fresh vegetables, fruits, and whole grains are the most nutritious. They haven't been stripped of their natural nutrients and are typically much healthier than their processed counterparts. They should look just the way they grow in nature. Look for foods that resemble their native state. For example, whole fruits like apples, berries, and oranges are full of vitamins, fiber, and antioxidants, whereas fruit juices or dried fruits can be high in sugar and low in fiber. Similarly, choose whole vegetables like leafy greens, broccoli, and carrots over packaged salads or frozen, heavily salted veggies. Whole grains like brown rice, quinoa, and barley are superior to refined grains like white rice and pasta. By focusing on these types of foods, whole, plant-based, and nutrient-dense, you can make huge strides in protecting your heart and arteries. It's about eating foods that nourish your body and fuel it with the right nutrients rather than those that harm your health over time. Remember, the choices you make today can have a lasting impact on your heart health tomorrow. So let's make every meal a chance to support a healthier heart. Please stay tuned for more videos on heart health and other health and wellness videos that are going to be coming from my channel in the very near future. And be sure to like, subscribe, and hit the notification bell so you don't miss out. Thanks so much for watching, and I'll see you in the next one.